Hey everyone, welcome back to the channel. In today's video, we're diving into an incredibly important and life-saving topic: the 10 signs of a heart attack that could show up a month before it happens. Yes, you heard that right, heart attacks don't always come out of nowhere. In some cases, your body might actually give you warnings well in advance. Now, before we get into it, make sure you hit that like button, subscribe if you haven't already, and ring that notification bell so you never miss out on more health tips like this one. Your heart is at the center of everything, so let's get informed, stay healthy, and possibly save a life, starting with our own. Alright, let's jump in. Okay, so first things first, what exactly is a heart attack? Zero tissue. A heart attack or myocardial infarction happens when the blood flow to a part of your heart is blocked. This blockage is often caused by a buildup of fatty deposits called plaque in your arteries. When a piece of that plaque breaks off, it can form a clot that blocks blood flow, leading to the death of heart muscle tissue. Now, the signs that we're talking about today may not be 100% conclusive, but they could be warning signals. If you experience any of these symptoms, it's crucial to take them seriously, and it's always best to consult a doctor. Alright, let's dive into those 10 signs that might appear a month before a heart attack. Some of these are subtle, but being aware could make all the difference. Sign number 1. Unusual fatigue. You're used to being active, but recently you're feeling more tired than usual. And it's not just a lack of sleep. This type of fatigue can feel overwhelming and may not go away with rest. If you're feeling drained without any apparent cause, it could be your heart giving you a warning. Sign number 2. Shortness of breath. If you're noticing that you're getting winded faster than you normally would, even when doing simple tasks like climbing stairs or walking around the house, that can be a warning sign. It's not always related to exercise or exertion, so pay attention to any unexplainable difficulty breathing. Sign number 3. Chest discomfort. Now, this one's pretty well known, but it's not always dramatic. You might feel pressure, tightness, or mild discomfort in your chest. This may come and go, but if it's persistent and happens more frequently, it's definitely something to look into. Sign number 4. Pain in the neck, jaw, or back. If you suddenly feel pain in your neck, jaw, or upper back that doesn't seem related to any obvious cause, it could be your heart. Sometimes heart pain radiates in these areas before it reaches your chest. Sign number 5. Nausea or indigestion. This might seem like something you chalk up to a stomach bug, but nausea or feeling full or bloated could actually be early signs of a heart attack. Women, in particular, are more likely to experience this symptom than men, so it's important to recognize it. Sign number 6. Dizziness or lightheadedness. Feeling dizzy or lightheaded, especially in situations where it seems like your body is just a little off balance, could be an indication that your heart is struggling. This could happen if your heart isn't pumping blood effectively, leading to a drop in blood pressure. Sign number 7. Cold sweats or clammy skin. Waking up in a cold sweat or feeling unusually clammy can be signs that something's wrong with your circulatory system. If this happens for no apparent reason, it's worth investigating further. Sign number 8. Swelling in the legs, ankles, or feet. Fluid retention in your legs or feet can occur when your heart isn't pumping efficiently. Swelling in these areas can be a warning that your heart is having trouble managing blood flow. Sign number 9. Sleep disturbances. If you're experiencing sleep problems, especially if you're suddenly waking up in the middle of the night feeling uncomfortable or experiencing heart palpitations, this could be a subtle sign that something's wrong with your heart. Some studies suggest that sleep apnea or disrupted sleep can increase your risk of a heart attack. Sign number 10. Frequent coughing or wheezing. A persistent cough, especially if accompanied by pinkish or white phlegm, might be linked to heart failure. Your heart is responsible for circulating blood, and when it isn't doing that efficiently, fluid can build up in your lungs, causing a cough or wheezing. Now, remember, having one of these symptoms doesn't automatically mean you're about to have a heart attack. However, if you notice any combination of these signs, especially if they persist or worsen over time, it's time to talk to a healthcare professional. If you notice one or more of these warning signs, the most important thing is to take action. Don't ignore them. Schedule an appointment with your doctor as soon as possible, and if necessary, don't hesitate to go to the emergency room. Early intervention can save your life. A doctor will perform a physical exam, may run tests like an EKG, stress tests, or blood work to determine if you're at risk for a heart attack. If you're at a high risk, your doctor will likely discuss lifestyle changes, medications, or further treatments to prevent a heart attack from happening. Now let's talk about prevention, because while we can't always predict what will happen with our health, there are definitely things we can do to lower our risk of a heart attack. 1. Exercise regularly. Just 30 minutes a day of moderate activity like walking can improve heart health. 2. Eat a heart-healthy diet. Focus on a balanced diet with fruits, vegetables, whole grains, and lean proteins. Limit your intake of processed foods, sugary drinks, and unhealthy fats. 3. Manage stress. Chronic stress can have a negative impact on your heart. Find ways to relax, whether it's through yoga, meditation, or just taking a walk outside. 4. Quit smoking. Smoking is one of the leading causes of heart disease. If you smoke, make today the day you decide to quit. 5. Keep track of your cholesterol and blood pressure. High cholesterol and high blood pressure are major risk factors for heart disease. Make sure you're monitoring these regularly with your doctor. 6. Get regular checkups. Don't skip those annual visits to your healthcare provider. Early detection of heart disease can help prevent a major event like a heart attack. Alright, that wraps up today's video on the 10 heart attack signs to watch out for a month before it happens. If you found this information useful, don't forget to like, comment, and share it with your friends and family. You never know who might need to hear this. And as always, make sure to subscribe for more health-related tips. Stay heart healthy, take care of yourself, and remember, better safe than sorry. See you next time.